இப்போ இத பத்தி இவருடைய அதர் ஹாஃப் ஒரு பிளஸ் இருந்தா மைனஸ் இருக்கும், ஒரு மைனஸ் இருந்தா பிளஸ் இருக்கும், இன் இருந்தா ஏங் இருக்கும். இந்த மேல் பார்ட் சொல்லியாச்சு, ஃபீமேல் பார்ட் இத பத்தி என்ன சொல்றாங்க?
Actually, the topic which we wanted to talk actually has been discussed by both of our colleagues. So I would like to just add few points, and I don't want to repeat the same. Actually, what Hahnemann meant in his effects of coffee was, he talked fully about the primary effect and secondary effect of the coffee on this letter, in his lesser writings. Hahnemann was to study the secondary effects of coffee, and that's why he wanted to avoid the coffee during the homeopathic treatment. Because as we all know, the substance which is going to stimulate the nervous system is going to depress in the secondary effect. So he doesn't want the patient to get more sick by taking coffee, because he has already been suffering from some disease condition and his vital force is weak. In that condition, if they are taking coffee, that's also in a very strong way, because as Dr. Pavalan has told, in the Hahnemannian days, the coffee was black coffee without sugar and without milk. But nowadays what we use is all full of adulteration. So that coffee excites the vital force and the patient is stimulated too much. Already the vital force is weak, and when this coffee stimulates it, the patient may not be in a condition to recover fast with our homeopathic medicines. So he has told in the second reaction, it depresses the nervous system and weakens it, and at last it exhausts the nervous system. So Hahnemann has advised to stop coffee. Then coming to George Vitolkas, who has been in our time, is there. He says coffee disturbs in a case because it affects the sense of well-being. Because when a patient says, I feel better when I take coffee, then in such patients, coffee is going to do some harm in him when you are going to give the homeopathic medicine, because it is also having an effect on the person. Then coming to many other authors have told, but as Sir has told, it's a long debate, and many authors are of the opinion that because all of us are afraid that we may lose the patient or the patient may not come to us, because they don't take homeopathic treatment if they say we don't take coffee. So many authors from their experience says when certain drugs are given, it's better to avoid coffee. And nowadays Dr. Master has told in his book, he talks about decaffeinated coffee. He says that can be allowed in the patients because the caffeine content which is present in the coffee is going to do more harm. But he too advises from his, after some various experiences, he also advises regular coffee drinking should be avoided. And as we all know, various researches are going on in various parts of the world, and every year the research results are being changed. One year they say coffee prevents heart diseases. Then another year they say coffee causes the heart diseases. So we can't just go by the results of it. And moreover, nowadays in our own practice, what we see is mainly more of the female patients who are mostly coffee drinkers or tea drinkers, whatever it may be, all present with iron deficiency anemia. And this anemia is very difficult to correct even with our homeopathic medicines. And so I could attribute whether this coffee drinking, which has been continued for a long time, it causes this deficiency of anemia and iron deficiency anemia. So that has to be thought of, whether stopping of coffee, and because previously in our olden day, our culture was not to take coffee or tea. All that taking only ragi, all those, and they didn't have any anemia problem. But nowadays, as the civilization has grown, we all say, okay, instant coffee, instant tea. But still, our health has not been improved with any coffee or beverages, whatever we take now. So that has to be given importance in our treatment. Then the one more point which I would like to say is, that's what the secondary effects of coffee has to be given importance, because as it impairs the nervous system, and moreover in our organon, what we say, our medicine, when it is taken on the tongue, it dissolves and it spreads through the sentient nerves and it's going to affect. And when we are taking coffee, it's going to weaken the nervous system. And the continuous use of it, either once in a way if we take, okay, but it's better to avoid. Now I don't say you should not take, because it all depends upon our own opinion. And So when there is a weakened nervous system, how will our medicine be able to act in a very better way? And the patient may not get fast improvement. And the patients who are taking coffee needs more repetition of doses, and they need more repetition of doses from my experience. And the improvement we find is also slow compared to persons, because as we already see in children, we find marvelous improvement, fast improvement than in old patients sometimes, because those children are not addicted to coffee, tea or anything. That could be, we can just make a note of it. Then that's what I like to conclude my speech. Hahnemann, as they said in his Organon of Medicine, the fourth person, a physician has to be like a preserver of health. So than saying whether coffee antidotes the medicine or not, as a physician, we have to be first clear which is good for the health of the patient has to be advised, and which the patient may follow or may not follow. That's not the thing, because which is good is we have to advise. That's our duty. So as far as my opinion goes, so as a preserver of health, we have to take the part of it, and we have to educate the patient which is good for health and which is not good for health. Thank you, sir.
Thank you, Dr. Anandhi. Could be weak. So coffee as a habit itself, she says, is not necessary for life. It causes more harm than the apparent joy and pleasure which you derive from the act of coffee drinking. So that is a totally philosophical approach to life which I respect. So that has to be kept in mind. But coming to the closer point of the clinical effect of coffee on patients taking homeopathic medicine, incidentally, even decaffeinated coffee has slightly only 10% less caffeine than tea. It does have caffeine. Decaf is not totally decaf. So, and cocoa, like I said, has as much caffeine in it almost as tea. And children take more of cocoa than all adults put together, and in spite of that, our homeopathic medicines work. Is it not? And then you Bonvita kudikada, Ghost kudikada, Ghost is the secret of my energy. So that work ஆகுது. அதனால இப்போ caffeine மட்டும் தானா இல்ல இதுல இருக்கிற இன்னும் வேற எது இருக்கு? When you see the diet restrictions imposed by Hahnemann for acute diseases, he said give whatever the patient wants. Only for chronic diseases he advises all these yes and no. And as far as restrictions go, whether it is coffee, tea or any other food article, if you see anybody writing on it from Hahnemann to Benninghausen and beyond, you will find that whatever was socially acceptable in their culture was generally allowed. And what was alien to their culture was generally restricted. If you go to the northern parts of India, you will find that most of the homeopathic doctors are advising the patients not to use tamarind in the food. Tamarind. Here, if we say that, nobody will come to you. And what are you going to eat? Kappa kalanja and kanji, that's all. Nothing else you can eat where there is no medicinal value. So to that extent, we, I think, are underestimating the powers of our own homeopathic medicine. It works far better than we think. It cannot be just subdued by the effects of certain things which we are using day to day in our life.